I thought today I would start to review some of the common questions that I get when patients come in for the first time and they have had no prior procedures or treatments. So the first one that I think is the most relevant is patients will come in and say, I need Botox, and they'll point to here and indicate that they have a line or a marionette that they don't like and think the answer to correct that is with Botox. Botox stops the movement repeatedly over and over and over of the skin causes a wrinkle in that skin. And so what Botox is doing is it's preventing that movement, and then the wrinkle will soften, reduce, or completely go away with time. Like taking a piece of fabric, and if you take your shirt and you fold it every day 100 times a day or 50 times a day or however many times in the same place, you're going to have a wrinkle in that fabric. So Botox isn't an iron. It's not going to come and take that wrinkle out. What it's going to do is stop you from folding it, and then the wrinkle will slowly soften and go away because you're not repeatedly folding it over and over. Fillers are a totally different product. They are a gel. Most of the products on the market are made out of something called hyaluronic acid. We make hyaluronic acid in our skin, and they've made synthetic forms out of plants, and they're a clear gel, and they come in a pre-filled syringe, and we inject underneath the line. So if you have a line here or down in here or volume loss, we go underneath to push that up. And fillers will last closer to about a year or longer, depending on what it is, where Botox, stopping that movement of that muscle, will only last 3 to 4 months on average for most patients. The amount of Botox we use is very dependent on how big the area is, how strong those muscles are, and predominantly they're used in these to make the scowl. When you raise your eyebrows up, though, the lines that go across, and when you smile and you make those crow's feet on the sides, that's predominantly where we use Botox. There are other indications. We use it for palm sweating, underarm sweating. Sometimes we use it in the neck for the muscles. Sometimes we use it in our muscles here. They're called the DAOs that pull down. Sometimes to give a lip flip, we put a little bit across the top lip. It gives a little more noticeability of your lip without putting filler in. So there's other indications for it, but the predominant area is this top 1/3 of the face, and then some of these other areas can be added. I hope that gives a little bit of information to everybody as far as the differences between Botox and filler, and we look forward to seeing you.